Welcome everyone, and thank you for attending this Lunch and Learn session organised in collaboration between the Knowledge and Library Services at NCIC and CLIC, the Cumbria Learning and Improvement Collaborative. My name is Ashley Eaton and I'm from CLIC, and today we are joined by Martin Wilson, who is Director of TIN Arts, and he will be presenting for us collaborative approaches to addressing health inequalities through the arts. You just click the next slide for me, Martin, that would be great. Thank you. So these Lunch and Learns are a relaxed and informal space for health and social care staff to come together and share their experiences. Next slide, Martin. So now, before we kick off, just some quick protocols. So webcams on at the start, although I'll ask you to turn them off very shortly. Mute, please, when you're not speaking. Please post any questions that you have in the chat, and we will also have time for questions at the end. Please listen with respect and be present. Please pass on and share the learning, spread the word about these sessions, and please be aware that we are recording the session. So if you could pop your webcams off, that would be much appreciated. There will be a link to feedback posted in the chat, so if you could please complete that, it would be much appreciated. It is very short, just a couple of questions. And I will now pass over to Martin.
Unmute yourself, then say thank you, Ashley, and say hello to everybody. Hello, everybody. I'm going to start with two slight apologies. One is I've been working through the presentation, runs at about 20 minutes. I want to do it in 15, so I'm going to talk slightly quicker than I normally would. And I've also got a bit of a rubbish cold, which means my voice comes and goes slightly, and I'll the odd cough. So please bear with me through this. So my name is Martin Wilson. I'm the Director of TIN Arts, founded in 1999. And for those 23 years, we've been delivering dance for health and well-being in education, school, community and hospital settings across the north of England. Driven by the passion that everyone should have access to the arts, it's a universal right we passionately believe in. The way we do it is we look at identifying, removing and reducing the barriers that stop people from engaging in arts. So often you'll find us working in the place and spaces where we feel arts or arts engagement is underserved and underrepresented. As well as my role with TIN Arts, I also have a part-time role which has just newly started as the Arts and Creativity Advisor for the Child Health and Wellbeing Network. It's a much new forming role, but if you don't know much about the network, you can see there's a link at the bottom to tweet, and you can find all the newsletters and things with that. And at the end, I've got some quick links. But essentially, it's a network that brings organisations together to look at addressing health inequalities across North East Cumbria. And all our work is about sharing good practice, connecting people together and groups together to drive work forward. I'm particularly interested in bringing cultural and health-based organisations together for collaboration and direct conversation. So that's part of my work, and hopefully there'll be more opportunities to connect with that in the work coming up. Today, actually, I should just quickly talk about the network priorities. And as you can see down the bottom, there's two particular ones which I'm going to use to talk today about place-based and arts and creativity. So I'm going to use a particular project that we've been working on to talk about that. And it addresses quite a few of those top 10 priorities on the right hand side, namely number 2, mental health, number 5, inequalities and access, as well as number 8, family support. So I'm going to talk about the South Tees Arts Project, or shortly known as STAR, which essentially is a dance project focused on addressing health inequalities, underpinned by research to understand how well that was achieved and what the impacts and outcomes are from that. And the ingredients within the project are just down the left hand side of the slide. Essentially, dance artists worked in schools. And that involved working with the children and the families as well at the same time. So it wasn't just a young person based project, but we wanted to reach out to the family engagement. There was visits to theatres as audience members, and for many in the area we worked in, South Tees was the first time they've ever been to a theatre. And there's also then a chance to go back towards the end of the project to perform in that same space, and for parents and caregivers to come along and see the work they created. To ensure continuity, there was holiday workshops to combat holiday hunger, so young people engaged in the project for a whole year, including the holiday periods. We provided support services around family support and link workers to make sure we wrapped around the whole family and didn't just direct with the children, and didn't just rely on communication from the school, as in letters, to send back to make sure I'm connected. And there's a collection of universities who walked alongside us and undertook the research evaluation. But as I go into the project, you'll see that this was not delegated down into parts, but everybody had a particular role, and we came together to collaborate around that. So the 5 kind of principles of working in our collaborative evolution of STAR, and is fairly true for all our projects, are these 5 titles on the right hand side. On the left, you can see there was 10 partners involved in the actual project, and in those partner organizations there was at least 3 or 4 people from each, so you actually talk about 40 people all coming together to try and deliver this project together. And South Tees Arts Project started off as a concept. It was responsive to where we were, so the area we're working with is very much deprived area, communities suffering from poverty and other multiple deprivation points. So we didn't have a framework. We didn't know what it was we wanted to do in terms of actual delivery. We knew what we wanted to address. We knew what the issues were, and we knew that we wanted arts and culture to be the vehicle through which we did that. So we wanted to come together and be responsive to the need of the area and to co-produce that. And by co-producing this instance, we talked about every organisation coming around the table going, well, these are my skills, these are my experiences, these are my challenges, these are the questions we have, these are where we want to place our work going forwards. What makes the most best asset we could pull together collectively to deliver a project which makes the best use of all our collective skills and experiences and questions. And so STAR was born from that. So as a dance organisation, we were very interested in working with family and community, as well as just young people. The children's services, the universities, the health network, all of us connected together to go, well, we do this and we do that, and that's our skills and that's our questions. And from that, co-produced the South Tees Arts Project, and that also involved how it would be delivered, where it would be delivered, with what age group we would focus on, and all these kind of component parts came together once we had decided what our kind of collective skill and experience was that we could build together as an asset. And the building capacity box is about that. It was about capacity built on what we could do, but also capacity building on what we knew as organisations, so this could be sustained. So if we were to explore children, young family in schools in this area, how does that apply to the rest of our workers as an organisation in other parts of the North East and North Cumbria? How does that change our workforce and change the skills and experiences they have, and they can take that away? How does that build Tin Arts as an organisation to be much more resilient itself and much more robust in delivering this work? Because STAR was one project, we probably deliver between 10 and 15 projects simultaneously in different environments across the North East and Cumbria at the same time. And that sustainability is crucial, because there's nothing worse than parachuting into the community, raising expectation, doing something amazing, fabulous, and then disappearing 12 months later. So how do we sustain the work in these communities, and particularly around resilience and skills and families and children? How do we sustain those skills, but how do we sustain that work in our organisations? And we take that work away, but also sustain the relationship we have between us. And the last one was that the agreement to be iterative, or to remain live. And if I told you that we actually started this project in back end of 2019 before the pandemic, and then for 2 years had to remain very iterative and very live and very responsive, and actually arguably even now as we enter into the second phase of STAR, there are things changing constantly on a daily basis at the moment. The needs of the young people and families around cost of living, fuel crisis, holiday hunger, warm spaces are changing. Our project is changing as a result of those needs as well. So these are the 5 core things that kind of were present and are still present and remain present. And actually all of the organisations agreed that they would be the 5 things that we would return to remind us of our journey. And underneath that were 4 more areas that were kind of conversations. And I would say these are the newer areas for my organisation, particularly in this field. And these were more discourse conversations around what is our shared vision. What's the mission we're trying to achieve together? So we've looked at what the skills we have, and we looked at how we want to build our organisation's capacities, and we looked at the area we're working to, but what's the vision we're all going to work to? And the vision was around addressing health inequalities through the arts in these areas. And how could that vision be backed up by, if you like, or underpinned by intelligence, that we know what we're doing? But the second part of that vision was that we would look at prevention from the word go. What we would not do is start a project, and then as issues or as areas of interest rose up, we would then work with them. We would signpost from day one. So we'd look at what might be the requests of us, and what might families want to know more about, and how they might want that. So we'd look at prevention from day one, and family support would be integral to that. So although it's a child-focused young person's project, we would look at the family as a unit, and that's why we were going to a school, and that's why we were connecting with Children North East, and that's why we were connecting with Head Start as well, that everybody was on board and looking at the family from the word go, and we were trying to ensure the family unit went on that journey with us. And so hence they were coming to the theatre with us for the performances, they were coming to school to see what was happening. And we hoped that that would, in turn, result in resilience, a much more resilient family unit and community across the school area. And resilience is so many ways, and we look at the resilience framework from the Boing Boing. I always call it the Boing Boing, which is boingboing.org.uk, have their resilience framework on there, and it's evidence-based. It's just a really interesting tool to look at what parts of resilience you're looking at, because resilience is quite a big term, but actually it sub-breaks down to so many different areas. So we wanted to make sure that this project had resilience built into it, alongside the prevention and the family support. And so at times you could go, are you sure this is an arts project? And it was, because it was delivered through artist engagement, but these things were really important to us, and for Till Arts particularly, with new areas of building capacity. I'll go on to my next slide and just take a drink, if that's okay. And this went through the whole project. So for example, when it came to the research, what we did not want to do is just delegate the research to universities and say, okay, you can work at arm's length over there. Yes, you should be independent, but actually what we wanted to do was make sure the research was connected in and working in the same principles and ethos of all other partners. So it was agreed from the outset the research team would explore children, parents, teachers, dance artists and project leads' views on the development and implementation of the STAR project. This is not a quantitative at-distance study. This is going to be a qualitative, evaluative, can't even say that word, study that would take everybody's opinions on board, and I'm trying to understand the journey and distance travelled by everybody connected in the project, because everybody sought to gain from the benefits, and we're all essentially beneficiaries. What was really interesting is when we looked at initially what kind of ways we could start to understand where baselining, where young people were at, there was very few ways we could do that, and the pandemic made that a little bit more difficult for us. So actually we decided to set out and identify and explore new suitable ways to measure the impact of the project on children's health and well-being. And in a bit I'm going to play you a short video, which is one of the ways that that impact was captured through the kind of the mouths and eyes of young people, how they would describe health and well-being. Because we were very conscious, if we're going to co-produce, the most keen beneficiary and the most important beneficiaries were children, people themselves actually, and how would they want us to measure their impact? And rather than just us use some kind of template quantitative study that's been signed off somewhere, what would their views be about what the impacts are on their lives? So there'll be a little film in a bit which talks about that. But the research would hopefully give us an indication of some emerging outcomes. So we would get some learning from this, and actually that we would all, in that building capacity nature, it would inform some follow-up study. We'd all take that on board and look at what that meant for us as organisations and us as a collective. Ultimately, from my perspective, I'd love to do more school-based dance programs that, you know, address health inequalities. But actually there's wider learning around this, and that qualitative co-produced nature of the research would be much more beneficial to us as a group of organisations, rather than just some. Well, there is beauty in numbers, I get that, but sometimes numbers don't tell enough of the story. They don't tell the narrative, they don't tell the journeys travelled. And so that co-production came through research, and this is just a quick slide to this translates across our approach across organisations as well. Important to share power. Nobody is the bigger partner in the room. Everybody has equality, and there's equity across people's agency, particularly children, and understanding what their priorities are for health and well-being. That all perspectives and skills were recognised and valued, and no one set of perspective and skills was deemed more important or more valuable, but they were all equal in that kind of conversation. And you'd respect and value the knowledge of other people as well. Actually, we all came from very different perspectives. Some of the organisations we would have never worked with before, and it took me a while to understand what their remit was, what their brief was, how they did it, and what their approach were. But time spent doing that actually with each other was really valuable and allows us to kind of build that shared understanding of where we were going, which is the fourth. Now, I definitely can't say that word, and I always get stuck in it. So number 4, beginning with R, that it was about making sure that it was a two-way conversation. This was not about the research just taking information away. This is about them feeding back and sharing back and hearing back, and constant conversation, dialogue about what was being said and what that meant and how that worked. So there was a constant communication, not just drawing stuff away and then you suddenly read about it in a research paper and go, oh, I said that. And building and maintaining relationships was the biggest part of it. And whether that it says in brackets attending dance activities and performances. And what I mean by that is everybody was there, all partners were there, the family were there, and the children were there, and people sat side by side and watched the same thing and shared the same experiences. There was no hierarchy in that, well, we'll just send the children, people and the families to go and watch the theatre, and we'll ask them afterwards what they thought about it. We all went and shared in the same cultural experience together, and that was really important. Time served and time spent. There's nothing better than sitting alongside each other, both looking in the same direction or something. And it's kind of quite an interesting metaphor for bigger ideas and agendas, about you sit down and you look at the same thing together. So we did that together. We made sure that was a kind of consistent throughout. As a quick, what did we find? Because it's always useful to find out. These are the benefits we found. These initially, the research is still being formed. I'm allowed to share this much so far. There's more stuff coming. It's a very long paper, which I'm sure people might want to read at some point. But what's really important to me is it's not necessarily what you see and what the words are and all the things you would hope to see are in there. It's actually the fact that there's so many different perspectives, from artists to children to teachers to parents. Everyone's got a voice within this research and in the findings of it, and it's all in there. And it's much longer paper, and it's backed up by lots of quotations and citations about where this information came from. But for me, it's important that we found that everybody had a perspective within that. And that's also true of the challenges as well. The teachers, the artists, tin art schools, parents, everyone has an opinion about how we could improve it and make it better as well. And it's all very constructive, and it's all really useful for STAR too. But again, everyone's represented in that, and tin art's very big about representation of people and voices and opinions. And so it's really important to me that the challenges are recognised, but the challenges are, they're able to come from all sorts of parts or parties or stakeholders in the conversation. So it makes sense to me to show you this one little quick minute film. These are young people who were given space to talk to a filmmaker who had no connection to the STAR Project Observer, and they were just simply asked, why do you think, or what might the benefit of STAR be for you? And there was no prompting and there's no practice, they were just given. So this is a very quick one. Hopefully you can hear this okay.
In dancing, it's a really fun way to get all your expressions out and help your mental health.
Because they make me nice and calm.
Because it's getting you fit, like when you're dancing and stuff.
And to be able to like make up stories through body language and without speaking.
It makes me feel like I'm in a place of happiness.
It's just very calming and relaxing when we do all of the like exercises.
With writing and things, it's just, you're very stressed and tense. But with dancing, you can be creative and you can do what you think is right.
Get to show off my creativity and my skills of dancing.
It's very good because you're like sad, it gets you more happier.
Because before I go and dance, I've got super excited.
And it gets all your sadness out of your body and angriness out of your body.
With dance, you get a break from reality and you get to relax and just let yourself be yourself. You're allowed to be yourself.
So as you know, from the mouths of babes, but I mean, you know, one young lad simply saying, you know, it takes me from sad to being happy. That's more than enough evaluation kind of back for me to hear someone that there's an impact and outcome around that. And so that was very typical of the kind of conversations or kind of feedback that was coming from young people, and it was great. And what my job now is to work with research team to make sure that voice, that authenticity is present in our evaluation report, and so you can hear the young people's voices as it comes through. And also we keep these kind of video vlogs of the stuff and add that into the evaluation as well. So I just wanted to finish on this slide, and like I said, it's those those 5 parts to me are crucially important. We responded to our need. We came together to understand what we had, and that involved young people and how we wanted to go about it. We made sure it built capacity in the schools, in the organisations, in the young people, in the families. We looked at something that was sustainable and not parachuted in and disappeared in 12 months, that there would still be like legacy and learning from this. And we remained iterative. We kept ourselves open to the changing environment and the changing landscape. And that's never been more so than pertinent than today, as we know. As I said, we deliver STAR 2 and we're constantly responding and changing it to reflect warm spaces and or fuel costs and those kind of things. So that's a very flying visit through the STAR project that I hope has shown a little bit about how we've kind of collaborated to look at addressing health inequalities. I think, did I have any more slides? I don't remember. Oh yeah, okay, that's one. Further resources. You want to find out more about the network? This is the professional I supposed to do. There is a Twitter you can follow, Every Child NENC. There's a visit our website, but that QR code is also a quick flash code to sign up for the newsletter, which is sent out once a month and talks about not only Star Project but all other projects across the network. Here we go. That was my slide. Thank you.
Brilliant, lovely. Thank you so much, Martin. It's wonderful to hear a project that's been, truly co-produced, and, as you're saying, everybody had that kind of shared voice, that shared power. It's just, wonderful to hear. I can see Sheila's popped a couple of questions in the chat. So Sheila's asked, where are you delivering in North Cumbria? Who are you working with here? And does this include public health too?
So in our 23 years, hello, Sheila, we have a history of delivering North Cumbria. We're not currently there at the moment, although we would be if somebody wants to invite us. But our previous projects we are very close collaborators with Prism Arts in Carlisle, who we've done a lot of work with. And my geography is not good enough, but there used to be a time when we used to come across and deliver residencies in Whitehaven. Mm-hmm. Is that North Cumbria? Yep. Okay. We had a. I should probably learn my geography, given that that's part of my role. So we're not currently there at the moment, but like I say, we have organisations who we collaborate with, particularly Prism Arts and Catherine Coulthard, who we know very well. So it's part of our working history, but we're not there. But we would be open to conversations about being there. The other connection I have is I work with the local cultural education partnerships, the LSEP, of which North Cumbria has one. And I'm the chair of the Durham LSEP, but all the chairs of the LSEPs across North East and North Cumbria, or North East, sorry, work together. But North Cumbria comes under my remit as Arts and Creative Advisor. So I'll be supporting the local LSEP to look at culture and health work.
Yeah, lovely. Thanks, Martin. Has anybody else got any questions? Oh, Karen.
Remember to put my mic on. I was just wondering, my role is Let's Talk Bereavement project lead for North Cumbria, and I know that dance is being used in a lot of places, to enable children to express their grief through dance. I wondered if you'd come across any of that, or there was plans, because obviously on the backdrop of the pandemic and that collective grief when the Queen died, certainly. There's people coming to my trainings that are talking about, how do you get your child to express their grief? And as I say, I've seen reports about dance being used in that way to allow the children to be themselves, and express it in a creative way. And I was just wondering if you come across any of that in your areas.
That's really interesting. I've heard dance and obviously used for lots of ways of expressing and communicating, explore issues. I've never heard it used for bereavement before. I'm actually quite intrigued and interested to be connected in to find out more about it. It makes perfect sense that it would be a great kind of kinesthetic tool through which to kind of bodily express ideas and thoughts. But no, I've any papers or anything you can share me. I'd be fascinated to read more about it actually.
Right, because I dipped into it, but it seemed to be a project around young teenagers, the one I was reading, and like that little the little lad said, it's about I can be myself and I can be creative, and that's what it was all about, enabling them to just express themselves in ways they weren't able to do it in any other way, they were saying how good some of the stuff have been, from these young people.
Yeah, great. Oh, no, I'm really interested. Thank you.
Yeah.
Thanks, Karen. Any other questions? How many families or children, Martin, have gone through the project?
So the first star had 200 young people, which and then I think the informal family count came out at about 570, I think it was, in terms of those siblings and families. What was really interesting, and the hardest thing to build with the families was essentially what I'd call trust, and by that I mean we were offering to wrap the Rand family services. So if they were connected into that project, not only would we support them to understand the journey their young person was taking, so there was a positive reinforcement at home, but then if they needed wider support, they weren't accessing the right services, benefits, or maybe there was behavioural issues in the home, we would help. They could pull on the link workers to support that work. But actually finding that back out that was happening was tough, because there's a mistrust around professionals and sharing information about what's happening in the family home. And we had to just kind of navigate that, actually, about how we build those conversations with them. Hence, that's why shared experiences culturally, looking at the theatres, it put faces to names, and it shared with people who we were and what we were doing and why we were there. And we weren't there to gather data to report back to a professional service somewhere that could end up in some kind of complexity around benefits or something. We were genuinely there. So I think there was a little bit of, because STAR is not, I wouldn't call it innovative, it's just a different new approach. There was a little bit of, what are you doing and why are you doing it and why are you doing it with us and how is this working? So there was a bit of building those relationships, and that's why I talk about sustaining and not parachuting. It took 12 months took a long time. Arguably, we'd want to get funding to be there for 5 years to go on a much longer journey with that, which is very difficult to do. But yeah, so that the conversation with families is big learning for us, and how you build that trust, and essentially remove suspicion about your motives was quite interesting.
Oh, lovely. Thank you, Martin. Any other questions from anybody? Lovely. Okay. Well, thank you ever so much, everybody, for attending. Again, just a reminder that there is a link to be able to give feedback in the chat. Our next Lunch and Learn session is on the 16th of November at 12 noon, where we will be joined by Josie Hodgkins, who is a carer and a member of the North Cumbria Cancer Care Collaborative. And she will be sharing what the collaborative is doing to improve the patient experience of cancer care. A link to this session Amy's already posted it in the chat for me. So if you'd like to find out more, follow that link, and we hope to see you there. Once again, thank you so much, Martin, for sharing that project. It was absolutely fantastic. And I hope everyone enjoys the rest of their afternoons. Thank you ever so much, everybody.